Hello and welcome to another edition of the Middle Georgia Spotlight. I'm your host, Jack Ellis. Thank you so much for joining us this week. You know, we've gone through a lot, not only here in Macon and the Middle Georgia area, but throughout the nation as it relates to COVID. And of course, we have looked to certain agencies and certain individuals to share information with us to try to help us safe, keep us safe so that we know what the latest protocols. And one of the people that have been at the forefront of this has been the North Central Health District. And the public information officer, we had him here about 18 months ago when this first started, and he shared information then, but things have changed in the last 18 months. He's back with us again to give us an update, looking backwards, but yet looking forward as to how we can move through this. And that's Mr. Michael Hokanson, who is the public information officer for the North Central Health District. Welcome back to our program.
It's good to be back, sir.
Yeah. Well, do you mind if I just take a point of personal privilege with you without saying to people, because I think you're an inspiration. When you were here a year and a half ago, you weighed about 50 to maybe even more pounds than you do now.
That's correct, yes.
And you've lost that weight, and you're not ill, you're not sick, so if someone want to go back and look at that 18 months ago, where we had you on here when this thing first started, and look at it now, they say, boy, he must be sick, but you're not sick.
No.
You, and being a health public information officer, you're a perfect example, and a living example of what can happen if you put your mind to it in terms of your health and fitness. So congratulations on the weight. How much weight have you lost?
Like I said, I've lost at least 50 pounds, haven't been on the scale recently, but I'm knowing that I need to continue my path a little bit more to get to that weight level that I want to be at.
Well, you're a good example, so you're leading by example, and I'm sure that means a lot to you and your organization, because COVID had a tendency, not a tendency, but one of the pre-existing conditions COVID was obesity.
That's correct, yes, and that's something we saw throughout the pandemic and continue to see in cases that the cases become more extreme. Is one of the major comorbidities when it comes to serious outcomes of COVID is obesity. So of course, having a change of your own health ideology, trying to eat better, exercise more, will help you in the long run in terms of preventing those serious outcomes of not only COVID, but a lot of diseases where obesity and the associated circumstances surrounding obesity can actually exacerbate those illnesses.
Now, but what you would recommend, I guess, as a health educator, a public information officer for a health district, that, yeah, you want to do this, but do what? Get in touch with your own physician so that you make sure that you be safe and healthy as you go through?
Exactly. Everybody reacts differently to stressors on the body, and that's one of the things that exercise is a stressor. So if you're somebody that hasn't been exercising regularly, you don't have a normal routine and you want to get started, talking to your primary care provider about what's right for you will be that first step to get you going. You don't want to put too much stress on yourself, or then you put yourself in an injury that you can't exercise at that certain level that you need to. So if you do want to get started in a regular routine, talking to a healthcare professional is the best way to start.
Now, what about diet? That you need to talk to a nutrition, or you just take certain things, like you said, sugar. You've taken practically sugar completely out of your diet, and that has a lot to do with weight loss as well. So there are little things you can do without consulting a physician.
Exactly. We all know the staple that people like to say is eat less, exercise more. But it's not just about eating less. It's about choosing healthier foods, eliminating a lot of the foods that can lead you to binge eating, can lead you to like an addictive eating pattern. I know that one of the things that I personally did was try to eliminate as much sugar out of my diet as possible. And of course, I also use a protein-rich diet because I'm into weightlifting, and that's something that needs to offset the weightlifting is protein. But once again, if you're a person with existing health conditions and you want to get started, talking to a nutritionist, to a personal care physician, those are the ways that you can get started without making sure that you don't have a negative impact on making too much of a radical change all at once.
Well, I'm not telling you anything. You know the statistics, but we know that there are a lot of people with hypertension in this area, in your district, hypertension, and we know that there are a lot of dialysis around, so that being diabetes, a lot of people with diabetes. Can that be controlled with diet? Do you all teach that you can control this with diet without taking medication or going to a doctor?
So while medication is an important part of certain people's response to either hypertension or diabetes, if you're in the stages leading up to that illness, changing your diet, getting exercise can help you reverse that path. If you haven't got that diabetes diagnosis, if you haven't gotten that hypertension diagnosis, doing things early on in this path can ensure that you will have a healthier outcome. Will reverse some of the situations that might lead you down that hypertension, high blood pressure, diabetes path. So once again, the best advice I can give is if you don't know exactly what you need to be doing, is to seek out a medical professional. One of the things that we offer in our health departments is an actual diabetes and hypertension clinic where we can talk to you, we can put you on a path that will put you in that right place. If necessary, we can also talk about medication, but one of the biggest things that we do in these is to talk to people about changing just those habits that we don't think about every day, but might need to be changed for a better health outcome.
What we have in statistics, we'll get in a little, ask you about some statistics, but on the surface, what we have heard is that minorities, especially African Americans, have been affected by this COVID more than anyone else for a lot of reasons.
Mm-hmm.
Some of frontline workers got to go to work, essential workers, but a lot of it we were discovering that was about a pre-existing condition. So do you have a special message, when I say you, your organization, health education, and pumping out information for that segment of the population?
So when it comes to COVID, right now one of our best tools is the vaccine. It's something that millions of people have taken. It's something that is going to provide a safety net for a community once a certain level of individuals get that fully vaccinated status. And of course, if people choose not to get vaccinated, they'll have to rely on those public health measures that we've been talking about for over a year at this point, making sure that you're social distancing, masking up in appropriate places, making sure that we wash our hands regularly, and just trying to keep safe from any kind of disease transmission.
Now, we are on several cable systems in the Middle Georgia area. You and the North Central District consists of how many counties?
We have 13 counties in Middle Georgia.
13 counties. Bibb County, I guess, is that the largest, or Houston?
Bibb, Houston, and Baldwin are the three
Houston
biggest
is larger
ones.
than Bibb, you know. Sad to say as a former mayor, but the latest statistics show now that Houston County has moved ahead of us in population. So the largest county in your district would be Houston County now, based on the 2020 census, preliminary 2020 census. But I understand the statistics in Bibb County, more people have succumbed to this illness and have been affected by this illness in Bibb County than any other county in the area. Am I right?
That's correct. Bibb County is the numbers-wise, it is definitely the one that has been hit very hard with COVID. Proportionally, Hancock County is the one that has been hit the hardest in our district, and there's a lot of reasons for that.
Now, Hancock County, we know the statistics there. It's a predominantly African-American community, very social and economic skills, very poor. So that leads to stress, and we know that stress and poor diets and not exercising. So you're right, there are a lot of reasons. But I don't know whether you're prepared or whether you can reveal statistics, but you are governed by what, CDC rules? You all are the state. I know Governor Kemp has said, hey, we're going to do this, and even though CDC recommends, who do you take your marching orders from in terms of your messaging when you're trying to get information out? From the governor or from the CDC?
So we, as a division of the Department of Public Health, we rely on the state office of the Department of Public Health, and of course that is overseen by the governor's office. So there's a line of marching orders that comes down from the state to the individual health districts, which then goes out to each of the counties that we oversee.
Of course, I understand you as an employee for the state, you can't go against what the governor says. If he said these are the new SOPs, you have to go with them. But what about individuals getting a mixed message, like down the CDC is saying, even if you're vaccinated, you don't have to wear a mask when you go out. Then other people are saying you should still wear a mask if you're vaccinated. What are you all telling people?
So we're still advising people to do what's best for them personally. They need to be able to do their own personal risk assessment, and if they're vaccinated and they feel safe around other individuals, then they can make that choice. A lot of places now are not requiring masks, but we do encourage any place that does require a mask, we want people to be able to follow those rules appropriately, because we know that private businesses can still have rules in place that public places might not have those same rules in place. It's a difference between jurisdictions at this point.
So the vaccination rate, if you had, I don't know whether you have those statistics yet in as to this, your district. I know the state is about, what, 34, 35% from what I understand?
It's up to 37%.
37%
Yes,
statewide. How do we compare Macon, Bibb County? Well, maybe if you have it by county, it's fine, and not all the counties, but the big one, or just the overall district. How do we compare with the state average?
So our district itself averages across our 13 counties of a 32% rate of fully vaccinated individuals.
Lower than the state average.
Lower than the state average.
And the state average is lower than the
Than the national
National,
average.
okay, go ahead.
Yes, and Macon-Bibb itself actually sits on that 32% as well. Within our district, we do have a range of, I want to say 25% fully vaccinated to up to 37% fully vaccinated across our 13 counties, with the average being, as I said, 32%.
So Houston County, how would it compare with Bibb? You said Bibb was on the lower end of this totem pole. How would Houston County compare?
So Bibb is actually, I would say, right about the middle
Okay.
of us. Like our range is 25, being Jasper County, that's the lowest one. And we don't have a lot in the 20, 25, 28% range anymore. We are moving up in those vaccinations. So Houston and Bibb sit at the same, pretty much the same level. I believe Houston County might be a percentage higher. And of course, what we're looking at there in those two communities, they've got a lot more providers giving the vaccine. We have a large hospital system in both counties. We have a lot of community groups that are offering vaccine at events, where the rural counties in our area, they don't always have those same opportunities.
Now, but what I'm hearing now, vaccines are readily available. They're begging people, not begging, but insisting that you go get the vaccination. What's your message? Your message is the governor's message, because sometimes I see a mixed message. Oh, don't worry about it. We open up. We're going. Are you really pushing the vaccination? The vaccine. Go and get vaccinated.
Yes, we definitely want people to take the opportunity to take advantage of these vaccines, especially right now while the state is still providing them. The U.S. government is providing this vaccination because right now all the vaccines that are available are still under an emergency use authorization. They're all purchased by taxpayers, so this is essentially a service that you've already paid for. If you want to take advantage of it, there are plenty of opportunities, not just through public health, but through private hospital systems, urgent care places. Like I said, community organizations are partnering up with a lot of places like churches, stores, events where you can get vaccinated. But I know that one of the things that people really, really want is to be able to visit their primary health care provider and get that vaccine. The problem with that is that a lot of primary care physicians aren't ordering the vaccine. They don't want the vaccine, or they've chosen not to get it, or they've not been allowed to get it. So there's still a long way to go before we see a true increase, a substantial increase in the amount of fully vaccinated people, because of the fact that it's one of the biggest things for vaccine hesitancy is they want to talk to the person that has been giving them medical care for years.
That's good, and I'd like to talk to my doctor before I put in a new medicine in my body as well. But by the same token, I think if we're going to get this thing under control, we talk about herd immunity.
Mm-hmm.
What is the threshold? 35%, 40%, 50%? Is there a magic number?
So a lot of people early on in vaccination heard through every single news source available about herd immunity, reaching that 70 to 80% vaccination rate. Looking at the numbers, looking at the patterns of how that percentage is increasing, it's going to be a long way before we get that 70 to 80% in Georgia or in the nation as a whole. There's going to be a lot of needing to shift focus away from providing vaccine at a health environment to meeting people where they're at, making it most convenient for them to get the vaccine, not have to change their daily routine or go out of their way to get access to this vaccine.
Well, right now, the health departments, the county health departments, all county health departments are available and authorized to give this shot, if you will.
So all 13 of our county health departments are giving the shot. That could be different in different districts where they have their own planning around how they distribute the shots. But all 13 of our county health departments in North Central Health District, they give the shot. They don't have an appointment necessary. People can go in on the scheduled time and date where we're giving out those shots and get their shot.
So you don't have to make an appointment. You just walk in. Whereas early on, when everybody was rushing and they thought there was going to be this long line and demand would be high. I guess it was early on, but it is dwindled, what I understand. So now you don't have to leave the county that you reside, and you don't have to make an appointment. So it's so I know that at first the president said he wanted everyone to be within, 5 miles or 2 miles or whatever it was of the vaccine.
Mm-hmm.
Have we met that in your district, you think?
No, and I think if you look at rural areas across the country, that still probably isn't happening. I'm going to go back to my example of Hancock County, where the health department itself is one of the few healthcare providers in that county. That's a large landmass where that's a place where you get shots. There's no hospital there. There's no EMT service. So looking at a lot of the rural counties in Georgia and throughout the United States as a whole, you probably won't see that intended goal of being within 5 miles of a vaccine.
Thank you. And in case you just joined us, we're talking with Mr. Michael Hokanson, who is the Public Information Officer for the North Central Health District. And he's a living example of how you can change your lifestyle and how you can get healthy and perhaps prevent this, not prevent, but lessen the effects of COVID. And he agreed that I could share with you that he was on our program when this thing first started last February, March, thereabouts, roughly 15 to 18 months ago. And he has taken his health care serious, and he's lost some 50 pounds. And he encouraged other, he did it the right way through diet and exercise, no crash diet. So we're not trying to give you any information to cause you to go out and do something. Contact your physician before you do that. But he's a living example that what you can do in order to stay healthy. So if we get back to the statistics, you keep hearing nationally that black people, especially black women, are succumbing to this disease. If they get it, they're more likely to be on a respirator, more likely to die if they're overweight, if they have pre-existing conditions. Do you have the statistic broken down by race, just by county period? Is it by race? In other words, we know how many homicides we had in Macon last year. At 52, we know that 99% of them were African Americans. Do we know how many people died in Macon last year, up to now, based on COVID and what the demographics were?
So that information has been publicly available for some time through the Department of Public Health. Anybody can access it on dph.georgia.gov. Now, of course, there is a split between, you can access the COVID case numbers, which list the cases, deaths, hospitalization, and it is broken down by race. That can be pulled for each individual county as well. And we can also do the same for vaccinations. We know that that health disparity has been a huge topic throughout the COVID pandemic, and that's one of the things that, while early on it might have been an issue, Georgia Department of Public Health has constantly been moving forward in transparency with this data to show how each individual community has been impacted on both the COVID side of things and the vaccine side of things, so we can make sure that we're tailoring our own actions to meet the needs of each of those communities.
Some states, Ohio, I think Michigan, maybe Pennsylvania, had lotteries and a lot of things, giving away things to encourage people to go and get the shot. Do we have any similar, not gimmicks, but do we have any type of incentives? There should be incentive enough not to get this disease to go get the shot, in my opinion. But, that's just my opinion. Are we promoting anything like that? Or are we just saying, the shots are available, we encourage you to go get it, now go find one and get it? Is that basically our message?
So as everybody is probably aware, if you're on social media, there's a lot of private companies that are providing incentives for people that show that they've been vaccinated, whether it's getting a free donut or any other kind of free product. I know that some of the health districts are doing promotions like that as well, whether it's an item or a gift card. Within our own health district, within Hancock County, that specific health department, through the CDC and REACH grant that we have out there, is also providing a $25 gift card for anybody that gets vaccinated at the Hancock County site. And we're looking at seeing if that will work moving forward. But of course, we are limited on resources as public health. So unless the state decides overall to do some sort of huge push on incentivizing getting vaccinated, I can see maybe, like I said, the rare cases here or there within health districts of providing something like that.
And you mentioned, you gave an example of an incentive giving out a donut. That's kind of counterintuitive, I would
yes,
say.
on a personal side of things, the things that you can get for free usually seem to be, might not be the best for your health to begin with.
Now, of course, now we've gone through, we have a lot of experience. I was speaking to this Board of Education superintendent as to the way forward going. That show will air shortly, probably after yours, as to what's going to happen in this fall at schools in August, September when they go back. Now, what are the guidelines? So they're under the state guidelines, so you're just reinforcing what children, so schools will be open based on, everybody will be able, if they want to. If they want to virtually learn, they can. But you all are saying the schools will be safe for kids to go back vaccinated or not vaccinated, wearing masks, without wearing masks?
So that decision is going to be dependent upon each of those boards of health or the state board of health. Public health serves as an advisor to those individual boards and the state board, but we are not the people that can say what cannot happen. And I think a lot of the schools will be understanding in terms of vaccinated individuals, because as of right now, only Pfizer can be given to younger children, and the age group there is only 12 and older. And we know that Pfizer is often not available in a lot of communities because of the requirements for storage. Even our own health departments here in North Central Health District, we don't offer Pfizer because we can't store it for a long time. So that's one of the issues when it comes to vaccinating school-age children, is access to that particular brand of the vaccine. One of the things that we've been able to do is partner with CORE, which is the community response agency that Department of Public Health is working with on a state level, to do these community events where they have mobile units. And very recently we've partnered with them to be able to give Pfizer at certain events. We're still in the early stages of that, so we're hoping to be able to announce more as that relationship grows. But it's a partnership that we're very, very happy about.
So the Pfizer, that one, even that you said, if you get two, I think it's a Johnson & Johnson on the one, right?
Johnson & Johnson's the
one.
one
So is that
shot
in the mix too in our district now, in our area?
Yes, we at our sites we offer both Moderna and Johnson & Johnson.
Moderna, not Pfizer.
Yes, Pfizer's got that storage requirement.
Because of the storage requirement,
yes.
Because of the temperature, what it has to be stored and
yeah,
all that.
for Pfizer to be on hand for an extended period of time, the place has to be able to have an ultra cold storage, which is something that is leagues beyond what a lot of places have before the pandemic. And of course, that's one of the issues too with these smaller healthcare providers, is they're looking at something that they would have to invest in, take a large chunk of change to buy this very specialized piece of equipment, and then on top of that be able to store a large amount of vaccine for a long period of time, because the minimum order for doses can sometimes outweigh the demand in these smaller areas.
So I guess Pfizer would do well in Thule, Greenland, northern Alaska, someplace where it's very cold. But on a serious note, the governor's last executive order says you can go back to the arenas to watch football or basketball, go Hawks, or you can. So when school, so you were saying that even the governor's SOP or his executive orders say you can go back, but the school or the districts, health districts, will still have the option of saying no, not in this district, or the governor's executive orders stands.
So the public health agencies, we can provide guidance, but we can't say yes, no to specific things. We can talk to partners throughout the community. We have partnerships with the school systems. We have partnerships with people in private businesses where we can tell them this might be what's best, but the ultimate decision is on that individual group or organization. And one thing that's important to note too is the last executive order regarding the public health state of emergency is going to be the final one per Governor Kemp. So this one looks like it will be going out at the end of this month. So following that, if there's no update, there will no longer be a public health emergency in the state of Georgia, which of course makes those executive orders then void, because the public health emergency is going to be ended unless there's an extension.
Yeah, and that's what brings me to my next question, because sometimes it's confusing. We hear that there's a new variant coming, that Delta one
Yes.
is here, so you need to mask up again because it's more deadly, more contagious. What's right? What's the official piece on this new variant?
So once again, with the Delta variant, because it is a new variant, there is not that much known about it yet. It's going to unfortunately take people becoming infected with it to learn more about it. And one of the more serious detriments in our communities right now is that while we have evidence of this new variant spreading, more and more people are deciding not to get tested for COVID. Testing numbers have been down for months and months and months. And we've seen a constant decrease in testing. So if people do not get tested, we can't know if the variant is in certain communities. And that's one reason why we still encourage testing if people even think that they might have COVID, to go seek out testing, whether through your own healthcare provider or any of the free testing that's available throughout the state. If we don't have the data, we cannot properly give people advance warning of the variant is in this area, that area, etc. And one of the other unfortunate facts of the matter too is that CDC itself no longer provides detailed information about variant cases within states. Instead, we're given a percentage for the state as a whole, and it's not really localized. So we know what's going on in the state of Georgia, but I couldn't tell you what's happening in any specific county.
So if we're not getting tested, but yet it's out here, so we don't know. So we have anecdotal evidence. Don't know how we would find out this variant, how deadly it is when people show up at the emergency room or get sick from it. And so we have two things that we have to do. It makes your job as a public information officer, I'm sure, very challenging and very critical and important. That is, get tested. Mm-hmm. And please consider getting a vaccine. You can't, I mean, the testing could very well be mandatory, and it is mandatory, and the vaccine is becoming mandatory to travel now. As you said, some companies are able to say to come in here. I know airlines are saying to go to Europe now, it's open back up, but you got to show me that you have been vaccinated, and before you got to show me a test that you have had within 72 hours. So I guess what comes first, chicken and egg here, but if you had to press one thing right now, the message would be get tested or get vaccinated, a combination thereof.
Right now, I would say, because of where we're at in terms of percentage of individuals vaccinated, I would promote vaccination more than anything else. As I said before, it's going to be one of the essential tools in creating a safety net in our community. It's great for the individual to decide to continue following those public health protocols, but that vaccine gives that backup. It gives that backup security against the spread of this new variant. And while we still don't know exactly how these vaccines interact with this variant, there are studies that show that it does have a good amount of protection against the variant. So that's why we would still encourage people to continue their vaccination. We want people to be protected. We do want a return to normalcy as much as possible, and unfortunately vaccination right now is going to be the one thing that's going to get us there.
Well, I want to say to the public, if things change when this program airs, because we tape, this is not live, obviously we're taping, and maybe it'll air 2 weeks from now. So if something changed, if you hear him say something, and then when this airs, because things are changing, like he said, it depends on what's happening. So you need to listen to the most current information that's on your website, I guess on your social media platform, or wherever people get their information from.
And that's something that we and everybody else has experienced throughout this pandemic, is a constant change of information as new things are discovered, new studies are conducted. I know that over these past year and a half at this point, people are burnt out on hearing about COVID. They're tired of keeping track of the new thing when it comes to COVID. But until we're at a high vaccination rate, it's going to still take the community being informed and being involved to ensure that we're protecting not only ourselves but others.
Well, I think you've given a lot of good information, and you're a living example of what you can do to take charge of your health, and we appreciate you being here. We've been speaking with Mr. Michael Hokanson, who is the Public Information Officer for the North Central Health District, encouraging you to take the vaccine and definitely go and get tested, because there's a new variant out here, and we don't know how deadly it will be. You don't know if you have it unless you get tested, unless you have some symptoms. Don't wait until you have to go to the emergency room. Thank you very much for joining us this week on the Middle Georgia Spotlight. Until next week, Jack Ellis. Goodbye.